Hello, I'm Joan Parley, Chair of the Boards of Doylestown Hospital and Doylestown Health Foundation, and a proud member and former president of the Village Improvement Association of Doylestown. As the governing body of Doylestown Health, the VIA has worked for more than a century to ensure that our community has access to reliable and advanced health care close to home. Our founders were the first to establish a hospital in this area, and Doylestown Hospital was the first in Bucks County to deliver drive-through testing and innovative treatments of COVID-19. It is our independence, bolstered by the generous support of the community, that guarantees us the flexibility we need to respond to a crisis. We are immensely proud of our hospital and the many healthcare heroes who every day ensure the rapid and safe delivery of care. With President and CEO Jim Brexler at the helm of a dedicated leadership team, and with the support of the Board of Trustees and the VIA, Doylestown Hospital was positioned to lead through a crisis, even in uncharted territory. We are so fortunate to have the extraordinary support of community members and businesses as one health system and one community sharing one vision. And we are very proud to share our story with you. Even with the unforeseeable challenges of a brand new virus, Doylestown Health remains a cornerstone of wellness in our community and a leader among healthcare providers in our region. And the VIA remains steadfast in our commitment to ensure it always will be.
Almost 100 years ago, Doylestown Hospital was founded in response to an unprecedented healthcare crisis, the Spanish flu. In 2020, we were faced with another pandemic, one that brought with it new and extraordinary challenges. In the face of an unprecedented crisis, Doylestown Health responded with surgical precision, finding new ways to innovate and work together across disciplines to save lives.
I've been a physician now for well over 30 years, and I've been in my role as Chief Medical Officer for about 15 years. And I would say in all the various clinical issues I've been involved with, I don't think there's anything I've been more proud of than the way we've been able to manage this pandemic at Doylestown.
Doylestown Health had a tremendous response to this pandemic. Everybody came together in ways that were unprecedented. It was at all levels. It was from the CEO of the hospital, all the administration, nursing, and I think that boosted morale.
During the early periods where reports were coming out of China, I would sit alone at night on my couch and have my own Excel spreadsheets trying to graph out what I thought the projections were going to be. And that was January and early February. And the moment it really became real for me was the day we were all sitting in the auditorium, myself with physicians, nursing directors, and we were like, how are we going to tackle this when it comes to our door? And do we have the supplies that we need to be prepared?
We were following the impact even as it was in other countries. And then as we watched the impact in New York and then into New Jersey, we could see this was just a matter of not if, but when. So our decision was to just keep everybody in play, everybody's working. And so we had a lot of work to do to make sure that we had the best protocols in place, had adequate personal protective equipment, had policies in place for safe handling of things and segmenting of patients. And together we grew the trust of the organization and all the associates to feel very comfortable that this was the right place to be.
On March 31st, that was when I realized that I was getting sick. I took my temperature. I had a fever at that point.
You know, he was home for 8 days, almost really by himself. I mean, I would leave, things at the door. We would exchange through the door. And when the doctor, said, go get a bag of fluids, I didn't make a big deal of it.
And I remember checking in, and they were pretty concerned because my blood oxygen level was low. and I had the beginnings of pneumonia in my chest that appeared on the chest x-ray. And I do remember the doctor saying, "You're not going home." It was just a very strange time, but I felt confident that I was in the right place and that I'd be taken care of.
So Doylestown Health is one of the signature organizations of our community, well respected by the community. We were in a growth mode, we continue to be. Just immediately prior to the pandemic, we had opened a new wing, our cardiovascular and critical care wing. We were on an upswing of growth in volumes of more patients knowing about the quality of Doylestown Health and coming to us. And so we were, if you will, sort of riding a high of positive growth and energy just immediately prior to the pandemic.
This is an evolving situation. Literally every day we learn a little bit more about it. I mean, we have the 5 individuals in the United States who are travel related. Now we see something which was clearly hinted at in what's going on in China, that you can actually have transmission from one to another.
In the early days of the virus, the greatest challenge was lack of information and lack of knowledge. And in addition to trying to get information from other geographic areas, specifically China and Japan, and then New York, who had experience with the virus, we tried to understand how the virus would impact us.
We were, like all the other hospitals in the country, we were scrambling to find out what is the best way to care for the patient. We knew from what was going on in Europe, what they had tried, and we all thought was going to be correct. Turned out maybe not to be the right way to go, so this was a learning process for all of us.
I think Doylestown Hospital has developed an amazing maturity quickly with how to manage this illness as the pandemic became more and more prevalent in the region. Scott Levy, the chief medical officer, developed a radar group, a rapid assessment, deployment, and response team that included many physicians, nurses, pharmacy leadership, and developed strategies as things were changing. As more and more was learned, evolution of how to manage these patients and manage the care teams and the hospitalists who were involved and the armies of individuals, especially the nurses who were so courageous and tireless, how to manage those needs as they waxed and waned, kept us, I think, very nimble and ahead of the curve.
We had to improvise. We were changing our practices daily and sometimes even throughout the day. What we did yesterday wasn't part of care the following day. What we did in the beginning of the shift was out of fashion by the end of the shift. And we relied on our intensivists and each other to update ourselves with current practices, data, anything we might have read that would have been valid to care for our patients, because our patients were declining so quickly and so rapidly, literally within minutes before our eyes.
As an infection preventionist, did I ever think that I would be involved with the pandemic? Absolutely not. But it's something we train for. It's something that we go to conferences on. The one thing we cannot forget is this is a brand new virus. So literally the CDC and the World Health Organization were changing their guidelines as they began to understand the virus more. At times it became a challenge. We would change certain practices 2 to 3 times a day and made sure that we had the appropriate PPE to keep the employees safe when they were going in to care for these patients. And as everything started to evolve and we started to realize the extent of the transmission, how easily it's going to be passed from person to person, we were pretty confident because we had already put those practices in place.
The one thing that was helpful with COVID is it shined a light on what pharmacy's been struggling with for a decade. So normally we'll sit and maybe updated guidelines will come out every 2 to 3 years and we'll redraft clinical pathways. But in this case, Monday we would start with a clinical pathway, and by the time the attendings were gonna switch to a different doctor, we were redrafting on Friday based on what we learned that week and what our patients were responding to. And Friday nights found us around a table talking to physicians till usually 7 o'clock at night, trying to edit our work so we could have fresh guidelines out for Monday when the new people started to benefit from the perspective of the people of the week before.
We had the ability, because we are a single institution, to make changes in our processes. We knew that we were going to need to have beds available for patients coming in. The emergency department had all new processes to try to separate patients coming to the emergency room with routine medical issues from patients coming in with possible COVID. In an overall sense, we had the ability to do things that I think larger health systems struggled with because of the layers of bureaucracy.
So several things that Doylestown did actually ahead of the recommendations from the CDC and elsewhere. We actually closed the hospital to elective surgery and procedures about 24 or 48 hours before it became required in this region. And we made a decision earlier on that nobody would be allowed in this building without masking, and that all associates here would need to be masking. It wasn't necessarily very popular early on, but very quickly the literature caught up with and the public recommendations caught up with our consensus.
In the early days of the pandemic, no one really knew how serious it would be in terms of risk for healthcare workers. We had reports by that time from Italy and from China of physicians, nurses, and other healthcare people dying. What we did was prepared for worst case scenarios. So, for example, we had a number of anesthesiologists who were really thoughtful about how were we going to manage the possibility of not having enough ventilators. That's just one example of a host of ways that we were looking to make our response as thoughtful as possible to protect the community and, importantly, to protect all of the healthcare workers at Doylestown.
The thing that we really focused on was making sure that we had the proper personal protective equipment and that we knew what needed to be done. There was a lot of confusion initially versus, of airborne versus droplet precautions and what needed to be done in reference to how we dressed and also how we cleaned the areas. And that was a bit scary for people who were expected to be at the bedside, and we were hoping that they felt safe and that they wouldn't get sick.
One of the things that is critical when you think about patient care is protecting the healthcare provider from the patient that they're caring for and from that pathogen. And at the center of care for them is respiratory protection, because it really is the barrier between the patient and the healthcare provider's own mortality. So when we were sitting and discussing the availability of these products, it was identified that we had a critical shortage of N95 respirators, which are the key component in protective equipment against a respiratory illness. And I had read about reprocessing N95 respirators and decontaminating them for biologic pathogens. There was a few different methods out there, everything from UV light to vaporized hydrogen peroxide. And I negotiated buying a BioQuell machine. So we extended our services with N95 respirator decontamination to anybody in our community who needed it. The number one most important thing about an N95 respirator is making sure it fits appropriately. It's molded to your nose and your face, and you do a seal check. So by deciding to take each person's respirator and label it, and then receive them in, decontaminate, and get it back to that exact person, you get the optimal benefit of, one, you're decontaminating, but two, you're preserving that fit.
There was a strong foundation of collaboration between the medical staff, administration, the board, and the associates that work here. And there was also a fairly lean administration so that there wasn't a lot of red tape to go through when you needed to make quick decisions.
One of the key points with the radar group is that things happened. If someone came up with an idea, everybody chimed in, and within 24 hours it was implemented. And I think that helped tremendously in terms of keeping the virus at bay, avoiding the major surge that we were expecting. It also helped in terms of bringing everybody in the hospital together. When you see and hear that there's a group that's actually looking out for your safety, it made people that work in the hospital think, I think, that they were being looked after, and there's someone that's making sure that they're staying safe.
The need for a drive-through testing area surfaced pretty early in the COVID crisis. The emergency department had staff dressed in full personal protective equipment going to patients' cars, evaluating patients to see if they needed to be seen in the ED, which a lot of them didn't. They just wanted to be tested because they had an exposure. Anybody coming for testing because they have to isolate wants to be able to have their results back in a timely manner. And Doylestown, it was unique because we managed to do that. We managed to work with a laboratory that could provide us with reagent and get test results back basically in a 24-hour period.
It was really invigorating to see everybody step up. And there's no doubt our response and the success we've had within our system, and that's not just a hospital, that's our nursing home facility as well. And to see people from the hospital volunteer to go help out our nursing home and bring some of our protocols and experience there and capabilities and help staffing there is all what makes this system work so well.
With COVID, you tend to have steps forward and then steps back. So, he's doing great, they prone him, he does good, then his kidneys fail. So now they have to start dialysis. And then, things get clogged because it creates clots in the body. So every time when I would call, especially the overnights, when I would call in the morning, they go, everything was quiet. I go, perfect. We love it. If there's nothing new, that is our perfect night. I mean, it was traumatic for me, traumatic for my kids. Anybody who's on any type of life support is, it's scary. It's really, really scary.
As we started to see more patients coming from the community with signs and symptoms of COVID and then go on to test positive to the COVID in March, we knew that we needed to have an alternative place for these patients to come in and be screened, and then based on the screening, determine whether they would be tested or not.
We were the first in the area to have a MASH tent. That was right in the front of the hospital, and I think that made the community realize we were well prepared for what we had to deal with. It also gave our physicians who were out in the community a place to see patients, and it made them feel that we were well prepared, and it also gave the associates in the hospital a sense of security, knowing that we were trying to avoid having COVID patients contaminating the rest of the hospital.
When we started looking at what the needs would be, particularly given that we were shutting down all elective surgery, all routine activity, one of the first questions is, well, what about the staff? What do they do? The fact of the matter is that we made the call that every associate was essential. We're all essential workers. We may not be essential in the job we had that we originally signed up for, but we're essential to be here as part of a healthcare organization.
So the hospital definitely switched gears and started focusing on COVID-19 and along with everybody else across the country and around the globe, trying to figure out more information about the virus and how do we take care of people in our community, how do we keep the people who work at the hospital safe. And we at the foundation were trying to determine our role in helping connect community members, connect donors to the immediate needs of the hospital because they quickly shifted. We quickly created a website that allowed people to see what our immediate needs were. We created intake forms to make it really streamlined. We had set up twice weekly collections where we were able to thank the people who were coming to us, collect the gear, and make sure that Central Supply and Purchasing had everything and that things could be inventoried and then distributed on a pretty turnkey basis.
We would not have made it had we not had people that said, we will make you masks, we will make you gowns. We had dentist offices closing and said, here, take our gloves. We're not going to need them right now. And then we had community members that were donating food. And when you're in healthcare, food is always a huge success. As healthcare workers, we don't feel like we're doing anything extra. But when somebody stops and says, here you go, thank you, we want to make your life easier, it truly makes a difference.
When the Heroes Work Here sign first appeared, it immediately raised the energy level in the organization, that all of the folks who were so stressed coming in daily trying to manage this horrible disease realized how much they were appreciated by the community.
The support that we got from the community was amazing, and it came from everywhere. They kept us fed, they kept us comforted, they kept us motivated, they kept us focused, and just provided us with whatever we needed to do our jobs. It was so far-reaching, and it was so appreciative, and we felt it. Kind of like we felt the love from the community and the family members of those we were caring for.
Doylestown Health would not be here without the generous and unwavering commitment the community has for it. And it really gives us the confidence that we can move forward, knowing that we may have some challenges here or there, but what we've got, it's not just this hospital trying to manage it or this health system, but it's all in from the community, all making sure that we are here.
I think it's impossible to read everything that's out there, especially when people are learning on the go and when you have multiple minds on the project. That's how I would describe my interaction with Dr. Zeckley, is that, both of us were constantly reading everything that was out there, whether it be potential treatments, complications, care plans, outcomes, and it was constantly changing.
This was a novel virus. No one knew what to do with it. And all we had was a several-month head start in other parts of the country. And through our research department, we found out a lot of different things. For instance, when I talked to the intensivists and they said their autopsies were showing tons of clotting and stuff, so that told us we better start to anticoagulate our patients early on. We also started steroids way earlier before steroids became popular. We were using other therapeutics, remdesivir. At the time that the allocations for remdesivir were going out, we were deemed a real hot spot, so we got lots of remdesivir.
At one time, we had as many as 55 patients in the hospital with COVID, so we had 3 nursing units filled with COVID patients.
Being a nurse during that time of the pandemic was emotionally taxing, physically taxing, and it really tested our grit. I saw resilience and courage from my coworkers day in and day out. We did the best we could to keep each other motivated, to keep each other focused, to recognize when our coworker needed a break, to recognize when our coworker just needed a moment just to get themselves together.
So the collaborative care was incredible because there was a lot of docs that just didn't have much work to do, whether you're an orthopedist or, the surgeries for elective care went down, anesthesiologist, a cardiologist, but they didn't sit at home. They came to work, and we had, for instance, proning teams. So to better manage these ventilated COVID patients, for instance, they had bad pneumonias, we had to flip them on their belly for 16 hours and flip them back.
At a time when we did not have drugs that were effective in treating these very critically ill patients, we did find a strategy that allowed us to support them and to keep them alive. We had great collaboration between the intensive care unit physicians, also known as the intensivists, and the hospitalists, who were the internal medicine physicians who take care of the patients in the hospital. And those two groups, along with the infectious disease team, kind of identified the most promising therapies, and we tried to standardize our approach at Doylestown Hospital, which was different than the approach at other hospitals. For example, we were very early on to use convalescent plasma, and we found success with that.
It's a very basic idea. If you get sick, you develop antibodies against whatever you are trying to fight off, whether it be virus or bacteria, and then those antibodies hang around in your blood. If you give me those antibodies, then theoretically I'll be able to fight off that same infection.
During the pandemic, processes changed very quickly. We went through about a dozen various clinical audit sets and clinical protocols for management of disease. Every time a new drug became more favorably used because of new literature or drugs went out of favor, we had to rewrite our protocols. And things that would take 2 or 3 days or 2 or 3 months to get approval were now able to be done in literally 12 or 24 hours. So we've learned to be much more efficient and expedient in making changes, doing that in a way without compromising quality or safety.
So I feel very fortunate to be medical director of a long-term care facility that is working in partnership with Doylestown Health. The meetings in terms of the leadership team was not just leadership at Pine Run, it was leadership at Doylestown Hospital as well. So from the CMO to the pharmacists to the intensivists in the ICU, pulmonologists, I had regular conversations multiple times a day with everyone. And we wanted to do what's best, not just for Pine Run, but for the community. And that was, making sure that we were all up to date with treatment guidelines, which were changing by the hour.
Without Doylestown Health, Pine Run would have struggled. Being part of the health system, we had access to staff. We had nurses come over. We had physicians come over. We had Central Supply contact us and ask us what we needed in terms of PPE. So the support was really there. That's the beauty of a health system. Had we been a standalone community, like many others, we would have struggled.
Through what I believe is the love of the nursing staff, Howard Brown pulled through. He got extubated. I was there when he came off the ventilator, and we were so happy. He was the second patient actually that was successfully weaned and taken off the ventilator. 2 days after that, he decompensated again and got reintubated. And we were just beside ourselves that he had to get reintubated. Then he got a tracheostomy. Then he had a slow, gradual, but steady recovery, left the intensive care unit and was in a step-down unit for several weeks, went to rehab.
And I remember at the time just being like, how in the world am I going to get to the point where I can get out of here? I was just singularly focused on getting home and just getting stronger. Mm-hmm. And they did it. So I remember the first time they have a stair, not a stair machine, but a tool where you basically walk up a flight of stairs. It's only 4 or 5 stairs. It took me forever just to get to the top, and then I couldn't even get down. The next day I tried it. It was a little easier. Next day, after that, it was even easier. And just the cumulative effect of doing it over and over and over. And there was rapid improvement. The doctors and the nursing staff and the technicians worked so hard to get me, and the therapists to get me to the point where I was healthy enough to leave. And I remember being wheeled down the hallway, and the corridor was lined with doctors, nurses, technicians, administrative staff, and they were playing Here Comes the Sun. There were tears in people's eyes. It was really a magical moment. And I just feel like I do have an appreciation just for life. It is cliche that you need to stop and smell the roses. I feel like I smell the roses.
I've always been very proud of the work at Doylestown, the commitment of the staff and the folks who work here, the quality outcomes and the awards that we've won. However, nothing ever prepared me for the pride that I feel right now, because through a pandemic like this, and when you see how many areas in the country have had huge challenges, we had our challenges, but the responses here, our ability to manage this, the care we've been able to provide our patients, the safety we've been able to assure for the people who work here, is something that really validates all the work, all the efforts that we put in up to this time.
This is a hospital where people were born here, then they had their grandchildren here, and multiple generations come here for their health care. And we want to stay here well into the future so we can continue that.
It's because of our independence, the strong foundation that we have in clinical excellence, and the incredible community support that Doylestown Health was really well positioned to respond to this crisis exceptionally. Through these continued challenges, in fact, despite these challenges, it is only reinforced that the vision that we have for Doylestown Health, the direction that we were headed before the pandemic hit, is exactly the direction we need to continue and reinforce as we continue to grow and expand for this community.